Welcome once again to The Sage. Thank you for being with us as usual. And we are excited because we've been announcing the series we're about to produce to you for weeks now. Last episode, we dealt with the very first topic in the series. We talked about everyday kindness. Even though I say so, I think it was a particularly touching episode in which we again reminded all of us that our people are suffering and that we can all be part of the solution. And so this series that we called Living Our Hope for a Compassionate Nigeria is making the point that for our hope for a better country to materialize, we must all live it out. We must all act on it. We must all find a way to contribute to things that will make life better for this country and for all of us. We said, while this may not apply to everything that needs to improve our country, but that, however, there are some specific sectors that are critical, that we all play our role to make Nigeria a better one, a more compassionate country. And the very, perhaps, important sector is the sector on health. If this is the first we're airing, or perhaps if you wonder why we chose health, although I think it's obvious, it's self-explanatory, health is a fundamental human right. A healthy nation is a prerequisite to progress. Let me admit, I'm also influenced by the fact that I'm a health professional myself. First and foremost, all my life, almost 50 years of it at least, I've been a health professional. Health is fundamental to our ability to function right as a people and as a country. But it is also an area that is very, very amenable to input from all of us. We can all do something. It isn't just about government. But before, I think, again, let me use a professional parlance that says, let us have a brief situation analysis. Why is it important? What is it about our health that needs to be improved? Why are we discussing the health of our people in Nigeria? I can only do this effectively if I pick up, forgive me if it becomes technical, if I discuss a few of the health indicators for our country, for our people in Nigeria. So why do we need to focus on health and do something about health as part of our efforts to make Nigeria a better place? To have it peopled by people of compassion. Health is fundamental. It is a fundamental human right. It is a healthy nation, a healthy people that can indeed make our country progressive. Let me show this. It isn't just an issue of passion and of talk. Let me try to prove this by citing a few of our indicators. Forgive me if it becomes technical, but I will try not to do so. Generally, Nigeria's health indicators are, compared to international standards, are quite bad. A few examples. Life expectancy in Nigeria today is estimated at 55 years. And yet, the global average is 73 years of life. So we're losing almost 20 years compared to the global statistics. Our infant mortality rate is estimated at 56 deaths per 1,000 live births, compared to the global average of 20 per 1,000 live births. Again, more than double the global estimate or global recommendation. Our maternal mortality rate is estimated at 512 deaths per 100,000 live births. Huge, compared to the recommended less than 70. 512 compared to less than 70 is a huge, huge. In fact, we have still have one of the highest maternal mortality rates in the world. Particularly in Africa, where we constitute such a large proportion of people in Africa. 1/5, I believe, is the estimate. I can go on and on. What about malnutrition and child health? It is estimated that the rate of stunting in Nigeria is at least 37%, compared to the recommended less than 7%. Our underweight children are as high as 22% of our children are underweight. What about our disease burden? Nigeria still, despite all the effort and all the work that has been ongoing, accounts for perhaps 27% of the global malaria cases in the world. That is huge. And it doesn't stop with, infections and so on. And non-communicable diseases, things like diabetes, hypertension, and so on, are on the rise, despite the fact that we don't even have the institutions and the facilities to deal with the problem. Yes, I don't want to spend time making everybody sad and depressed, but it is important to give the statistics to support the fact that we have a problem here that needs to be addressed. That we have problems, and yet our infrastructure is so inadequate in dealing with it. Let us quote some of that. It is estimated that our doctor-to-patient ratio is 4 to 10,000 in this country, when the WHO recommendation is at the very least. Our health spending must be mentioned. Again, the estimate is that we are only spending 3.9% of our GDP, our gross domestic product, on health, when the standard, at least Africa uses, the Abuja Declaration, has for years recommended at least 15%. Our routine immunization coverages for our children are still only around 57%, when we should be doing at least 90% as per recommendation. I think I will stop here. I think for anybody listening to me, I should have made the point. I should have made the case that there's a lot to be done. We need to do a great deal more to be able to compare to global averages, but also to be able to improve and make the lives of our people much better. And so for us on the stage, it's not just about talking about it. It's about how do we all work together to achieve optimal health, which we have said is a fundamental human right. Optimal health in Nigeria for us as a people. So what are the things that we can all do to contribute and make this happen? Let's break it down into some critical factors. Let me start by, we need to strengthen healthcare access. What do we mean by that access? Access implies availability as well as ability to avail yourself of whatever it is you're providing. And so, to be able to do this, we must do certain things. We must expand our primary health care services. Primary, that goes to the community where the majority of our people actually reside. Facilities have to be manned. We must train more doctors and nurses and other healthcare professionals who of necessity need to man these facilities. We need to improve our emergency services, especially in these rural areas. We need to make our health services, our health care affordable. We need to look at mechanisms that will make it so. Whether it's health insurance, whether it's support from one another, whatever. Universal health coverage must be fully implemented. It is a technical term for people in this field. But it is clearly defined and so on by WHO. But the point here is that it must be fully implemented. With better government funding and lower healthcare costs for all Nigerians, not selected Nigerians. And within Nigeria, not the situation that exists in which those of us who are privileged go outside to get those services. It has to be available and accessible to everybody. We need to focus on issues of disease prevention and control. Some of these factors include things like vaccination, preventive activities, vaccination programs, malaria control, and so on and so forth. Tuberculosis control, providing clean water. So many things that will actually prevent the diseases and prevent the conditions. We need to intensify efforts on maternal and child care. Our maternal mortality rate, as we had demonstrated before, is one of the highest in the world. Nigeria provides the largest figures for maternal deaths in the world. No woman should die giving birth. That is a divine service. We must ensure safe childbirth, and we must promote family planning that allows families to indeed more concretely plan and ensure that their families are cared for, given birth to at the right time and when they are ready. But you see, health is so complex sometimes in a way, because it's also not just about medical services, but also about wider things like nutrition and food security. We must fight malnutrition. We must educate our people about what is a balanced diet, what to eat and what not to eat, and when this should be done, at what ages. What the baby needs is different from what the young boy or girl needs, and what the mother and father needs, and what the elderly like myself do need. So nutrition. Something that is beginning to gain some prominence of recent, but which we must also focus more on, is the issue of mental health awareness. With the increasing hardship in this country, the incidence and prevalence of mental health in this country is increasing at a rate we are not even beginning to acknowledge yet. Suicide rates are increasing, depression is increasing, so many of those mental health problems are on the increase. We must intensify efforts at education, at providing them correct services, but also recognition that something needs to be done and that it is happening to us. And so that leads me to the issue of public health education, of course. So crucial, because unless you're informed, you're not going to take steps to correct the issue. But we shall dwell on this a great deal more in the coming episodes on health. Let me also say that environmental and occupational health are important issues that are often ignored in this country, but which are crucial. I remember when I was training as a medical student, that issue of environmental health was a very, very important one. I seem to get the impression that it's decreasing. I remember in my time as a student that we had environmental health and sanitation officers employed by government who were going around actually inspecting facilities and helping our communities deal with environmental health issues. I think, again, forgive me if I am lost touch with what government is doing, that this is an area where more focus is urgently needed. As a country, for the services we've been talking about to increase, to improve, there must be research. There must be innovation. We must intensify efforts at local drug production. We must be there, not just depending on the outside world to do it for us, but supporting our research and innovation amongst our scientists so that we respond to our own local problems. Nigeria must invest in medical research, strengthen disease surveillance, and produce affordable, high-quality medicines locally, and not be subject to importation of medicines from many parts of the world, substandard medicines. We commend the efforts of agencies like NAFDAC, but we think there's still a great deal more to be done. I think I will wind down on this by saying that the ability to do all the above, to a large extent, must be supported by governance, good leadership, and policy enactment and implementation. Good health requires accountability. It requires anti-corruption measures, whether it's with regard to drugs or whether it's regard to the services provided to the people. It also requires a stronger public-private partnerships. Many institutions, medical institutions in this country, a significant proportion are actually private institutions. There has to be greater collaboration between the public sector and the private sector, with adequate monitoring so that standards maintained. A healthier Nigeria is possible. But if this commitment from government, health professionals, private sector, and indeed every citizen. And so in listing the many things that need to be done, I hope we have made the case that a healthier Nigeria is possible. But it requires the commitment of all. Commitment from government, commitment from health professionals, commitment from the private sector, commitment from donors, indeed commitment from every citizen. Together, we can create a future where health is a reality for all. And so I'm going to end this introduction to health, the health topic, by saying that, again, as usual in the Sage, we zero in to the fact that each one of us can do something. It isn't that government is not doing, or that the doctors are not doing, the nurses are not doing. Each one of us can do something. Each one of us can help. It is everybody's responsibility. And let me particularly illustrate some of these things that we can all chip in and do. One, we had made the point earlier that personal health and lifestyle choices are very important for health. You, the viewer watching me, the decisions you make about yourself, your health, is important. You must take care of yourself. We must take care of ourselves. You must make the right choices about what you eat, for instance. The right choices about whether you are exercising. Do you sleep? Do you leave yourself stressed out all the time? And so, do you drink excessive amounts of alcohol? Are you smoking drugs? So many personal lifestyle choices are perhaps even more important in your health than anything else. So apart from things you do personally, as a people, as a community, we can do something. Community health initiatives are crucial. When I look back on my childhood, from where I feel privileged to have come from, a great deal of community effort is devoted to health. The people from the southeast where I come, for instance, allow me to quote them, believe a great deal in the fact that health of the community is everybody's business. Many health centers are community built. If it's time for immunization, the women meetings and so on are there, propagating it in their meetings and so on. I once functioned as a medical officer of health in one of the largest local government areas in the country down there. And I know that these women groups and women meetings were important. They were key and instrumental in making sure that mothers and families are persuaded to take up health care. Health education and awareness, which is crucial for understanding what to do and where to go to improve the health of yourself and your family, is also something that we can all mobilize ourselves as groups or individuals and do something about. And we're looking forward on the Sage to bringing that particular example to life to you and show some experts who have indeed taken it upon themselves to make their contribution towards health awareness and education. Advocacy and civil engagement is something we can all be a part of. We have to make our voices matter. those senators and legislators that we vote and send in there, hold them accountable for whether the policies are being enacted and implemented within our communities. We need to recognize the debt we owe to one another in helping our fellow citizens, our neighbors, our families access the healthcare services. Some communities organize themselves so that expectant mothers, as they are delivering, communities provide transport that takes them to health facilities. The examples are endless, but the examples have been given so that each one of our viewers listening can see a significant possible role for him or herself towards personal health care, but also community health care. So there's a great deal to be done. And we're going to ask you to please join us in the coming weeks as we explore these areas further. It is our hope to talk to individuals who are already doing something like some of the examples we cited, to talk to governments who will share with us what they're doing, improvements they're making efforts to ensure happen, and so many others, perhaps associations in medicine who will talk about their own efforts. You cannot afford to miss the coming episodes on health. Who knows? To the viewers watching, let me say that it may well save your life. Something you hear here, something you take on and implement, may save your life, but also save the life of your family and friends. Don't miss the next episode. I thank you.
Walking through the ashes of dreams we left behind, building walls between us in the corners of our minds. We've lost the love we're owed, the kindness we've misplaced, but the hope is in our hands to rewrite this broken space. So lift the veil and clear the smoke. The cracks will mend where hearts are broke. We're stronger when we reach across. No more sinking in the loss. The light ahead, it's not too far. If we become the change we are, look beyond the shadows cast. We'll build a future made to last. If we become the change we are. The land our fathers saved is being sold off piece by piece. Leaders count their riches while the hunger never sleeps. The dreams they promised us have faded in their lives, but the power's in our hearts to reclaim what's been denied. So lift the veil and clear the smoke. The cracks will mend where hearts are broke. We're stronger when we reach across. No more sinking in the loss. The light ahead, it's not too far. If we become the change we are, look beyond the shadows cast. Let's build a future made to last. If we become the change we are. become the change we are. Oh, the light ahead, it's not too far. If we become the change we are. So lift the veil and clear the smoke. The cracks will mend where hearts are broke. We're stronger when we reach across. No more sinking in the lost. The light ahead, it's not too far. If we become the change we are, look beyond the shadows cast. We'll build a future made to last. If we become the change we are.